Thanks, Tatey. First, I'd just like to thank Trevor and ADS for asking me to come along today to talk about treatment of mesothelioma. So what I plan to do is talk a little bit about what the standard treatments are, what we do at the moment, and then to talk about, well, where's the research taking us, and in particular immunotherapy, which I'm sure there's going to be questions about. So why is this an issue? Well, I'm sorry, I only got here about 10 minutes ago, so I've missed all the earlier talks, and I'm not sure whether anyone's shown these sorts of graphs, but the issue is that the incidence of mesothelioma is rising. So from a point of view from an oncologist, we need to get more effective treatments because there's going to be more patients to treat, more problems occurring. And again, I'm sorry if this is repetitive, but what is mesothelioma? Mesothelioma is a tumour. It's a cancer of mesothelial cells. And mesothelial cells, as Dr. Slaughter was alluding to, line membranes within the body, within the pleura, and also the peritoneum, which is the membrane which lies the abdominal cavity. But generally speaking, let's see if I can drive this thing. Yep. Most patients with mesothelioma present with a problem in their chest. The cancer starts within the pleura, which is the lining around the lung, and that's how they often present then, is with those sorts of symptoms. So they may present with shortness of breath because of a build-up of fluid within the pleural cavity, chest pain, fatigue, weight loss. Some patients present with unexplained fevers and night sweats. And generally speaking, for nearly all patients, there is a history of asbestos exposure, often dating back 30 to 50 years. Now, why that's relevant from a medical point of view is because many patients then, at least somewhere between 55 to 80, when they present to us with this diagnosis. And with treatment of any type of cancer, we always have to take that into consideration, how their body's functioning, how the treatment's going to affect them. So you've just had an eminent radiologist presenting x-rays, so I'm not going to spend too long looking at this, but this is a typical way that patients present, often with fluid build-up. But it's not only the fluid, because we can deal with the fluid by draining the lung and by doing a procedure where we can get rid of the fluid. But the other problem is the solid part of the tumour, which is, as you can see in this case, encases the lung, and that's what may cause a lot of the symptoms. It restricts the ability to expand the lung. The tumour may invade into the nerves which sit underneath the ribs and cause significant amount of pain. A biopsy is really important. We need to know what we're treating. There are other types of cancers that can mimic or present in the same type of way, particularly adenocarcinoma, which is a cancer which starts within the lung, and the treatment for that is completely different. And not only is the treatment different, but as has been alluded to, there's the issue of compensation, because mesothelioma nearly always is associated with asbestos exposure. So when the patient comes in to see me, what we really need to do is make some assessment. Okay, well, what does this patient look like? What do we think the future's going to hold for them? So that means really what we're talking about is what their prognosis is, what's the outcome of their disease. And there are various things we factor in to try and work that out. One of them is the type of mesothelioma. There are different types. Epithelioid is a commoner type. It tends to be a more slow-growing variant. And then at the other end of the spectrum is the sarcomatoid, which tends to be more aggressive. We talk about performance status. So that's really how active the patient is. They're coming in a wheelchair, or have they just been out playing golf before they come for the appointment? That's important. Their age, symptoms, so whether people, for example, have lost a lot of weight, they've got night sweats, where they're feeling unwell. And then there's things on the lab blood test that we check for, which can also give us an indication of how active it is. So the prognosis of mesothelioma is highly variable. Some people, they may live for years with mesothelioma, but unfortunately for many patients, the survival time is often less than 12 months. So what sort of treatment can we do at the moment? So I'm an oncologist, so I spend a lot of my time looking at chemotherapy and drug treatment. Surgeons are involved. Radiation treatment I'm not going to talk much about, and you've had Dr. McConaughey talk about palliative care, so I'm not going to touch on that. Surgery, well, we need the surgeons involved to make a diagnosis. Often they'll do a thoracoscopy where they put a tube like a telescope into the chest, have a look around, take some biopsies, put some talc within the pleural space to stick the lung up to stop the fluid from reaccumulating, and that's a very effective way of managing the fluid. And then there are more major procedures, which we'll touch on, which involves trying to strip the pleura off the lung, and even to the extent of doing what's called an extrapleural pneumonectomy, which involves taking the whole lung out, stripping off the pleura, sometimes even taking ribs. That's a massive operation. And that's not lunch, that's a specimen from one of these operations. The important thing about this is because often when people are diagnosed with mesothelioma, the first question is, why can't it be cut out? In the majority of cases, it can't. You have to be fortunate to have a presentation where the mesothelioma is just limited to one area, very fit patient, no evidence of the disease elsewhere. And you need a surgeon who's done a lot of these, because this is very involved surgery. And the last thing you'd want to do is have a patient where, you know, in a procedure where maybe the chance of not getting through the operation, dying from the operation, may be as high as 1 out of 10. And at the moment, there's no real randomised evidence to say that that necessarily improves people's long-term survival. So chemotherapy, that's what I do. So obviously with that, there's questions. Why would we do it? Who should have it? When do we do it? What do we give? And what do we do afterwards? Unfortunately, chemotherapy can't fix mesothelioma. It's not curable. And so, very importantly, what we're striving to achieve is to try and improve people's symptoms, pain, shortness of breath. We want to try and improve their life expectancy, but without the cost of having a lot of side effects. What we know, and chemotherapy for mesothelioma has been around for probably 10 to 15 years now. We know that probably up to half of patients that we treat with chemotherapy get a benefit. And what I say to the patient, it's one thing to make the x-rays look better, but obviously we want to make the patient look better. So importantly, we want their pain to improve, their breathing to improve, and we can measure that with breathing tests and getting people to do pain scores. The worry, of course, with chemotherapy is, well, how do the side effects affect a person? And you know that if there's a lot of side effects from treatment, that can affect their quality of life. But the issue is that the disease is affecting their quality of life already. The side effects we can manage, we can minimise those. But the symptoms, once they start, can be relentless. So we aim to try and improve the symptoms with the treatment. We give chemotherapy for usually about 9 weeks, and then we do another scan. If it's not working, there's no point in doing it. We need to make sure that the patient's getting a benefit. And if it's working well, we'd normally do 6 rounds of treatment. Now, this is a patient I treated some years ago, and all it really highlights is that, yes, if you look at that scan, you think, gee, that's pretty impressive. We can see that this solid part of the tumour, the rind, as we call it, is significantly reduced, but there's still residual activity there. And we know that, unfortunately, it is going to grow back at some stage in the future. So who should have chemo? Well, we need to make sure that the patient can tolerate the treatment and need to have good kidney tests. Nerve function is because some of the drugs can cause numbness and tingling in the fingers and the toes. They don't have any other major medical problems. And again, getting back to the issue that they're actually doing things, they're functioning and not terribly sick before we start. The question sometimes is, well, when the diagnosis is made, should people have chemotherapy straight away, or can we wait? And it's an important question because people have been given a diagnosis of a life-threatening cancer. They mightn't be feeling 100%, and we need to make sure that what we're doing is for the best for them. So there are some patients, it seems, where you probably can wait a while, and others, if you're going to do it, you need to get on with it. So for early treatment, when a patient comes in, you need to say, okay, well, how much disease are we dealing with? Is there a lot of tumour involved? Is there a lot of that solid rind I showed you on the scan? or is there just a little bit of fluid that the surgeon's hopefully dealt with? Do the patients have a lot of symptoms, or are they symptom-free? Are they unwell, and do they have a more aggressive type of mesothelioma than the slower moving? And obviously, what the patient wants has to be an important part of it as well. So what do we give? Well, the standard treatment at the moment are two drugs, one called cisplatin, or a cousin of cisplatin called carboplatin, and a second drug called pemetrexed. It's put in through an IV. Usually it's done in a day infusion centre over somewhere between 4 to 6 hours, once every 3 weeks. We always give the patients vitamins. We give them B12 injections and folic acid tablets. And the purpose of that is to reduce the side effects from this particular drug, and it's also some evidence to suggest that it might actually improve the way that the chemotherapy works on the cancer. So there are side effects, generally not a lot of hair loss. Nausea is an issue, but we're pretty good at preventing that now. We have much better drugs at preventing it. So the patients have anti-nausea drugs before the chemo goes in. They're sent home with anti-nausea drugs. But there are other things, constipation, tiredness, mouth ulcers. We need to watch the kidney function because for some patients the kidneys can be affected by the chemotherapy. So as I showed you before on that case, even though we look like, we may have shrunk the mesothelioma down to almost nothing, we know that on average it will start to grow back, often as short as 4 to 5 months afterwards. If we look at doing chemotherapy again, sometimes it works, but it's almost like a law of diminishing return. So when you have more treatment, the likelihood of it working is not as good as it was second time around. So really what we need to do is to either find something instead of chemotherapy or after chemotherapy to try and maintain the benefit. So why can't we do better? So that's probably a question someone's going to ask. Okay, well, all this money's going into research. Why can't we cure cancer? Why can't we fix it? And the issue is it's not as simple as it looks. It's like a moving target. So we know that for cancer to occur, there has to be a genetic change within those mesothelial cells. But whatever triggers the cancer is not the same thing that continues on. So within 3 to 6 months, if you examine the genetic structure of the mesothelioma or the cancer, it's not going to be the same as it was when we first made the diagnosis. The other thing is as we treat one particular part of the cancer, it changes. It changes into something else and will no longer respond to the same treatment. And the other thing we're going to talk about is that the cancer cells can avoid the immune system. So that's a picture of a cancer cell. Looks fairly happy and benign, doesn't it? But it's not. Within the cancer cell, the main brains of the process is within the nucleus, where the DNA, the genetic structure is. And if we examine that a little bit more closely, we'd find there would be multiple thousands of genes that have already undergone some sort of transition. And what happens then is that each gene encodes for a certain protein, which would be responsible for that cancer cell to grow and to survive treatment and to spread to other parts of the body. The difficulty is that if we put a block in one part of the highway, they start to head off somewhere else, and that's the dilemma. So we think we've got it covered, then it starts to move and it no longer responds to treatment. So hopefully you can see that okay. This is actually out of a journal that arrived about 2 weeks ago. Very timely because it was an article all about the up-to-date treatment of mesothelioma. So I'm not going to talk about all of that because we haven't got time, but any of you who are observant might notice something in this area where it says, can't even read it to be honest, mesothelin targeted therapy, you'll notice thing where it says CAR T cell. And then if you look over here where it says immune checkpoint blockade, T cell. And over here where it says neoantigen based vaccines, T cell. And that's very important. So the T cell is the main armament, the soldier of the immune system. I'm not going to talk too much about these other types of therapies, except to say that these drugs, where it says anti-angiogenesis therapy, they're all about trying to interfere with the blood supply to the tumour. Cancers need oxygen, they need nutrients, they need a blood supply. These sorts of drugs have been designed to try and interfere with the growth of those blood vessels. Unfortunately, most of the trials have not been very promising with adding those drugs in to chemotherapy. I'm not going to talk about this too much either. This is the CART therapy, C-A-R-T. And it's a very involved, it's a very costly treatment where you actually take immune cells out of the body, genetically engineer these T cells and inject them in. In the US, it's been approved now by the Food and Drugs Administration for lymphoma and leukemia. The cost of the treatment is about $500,000. So it's a very expensive treatment, but for some patients, when there are no other options, it can be very effective. So there is research being done around the world looking at CART targeting mesothelioma cells. So we'll have to wait and see about that. What I'm going to talk about is immune checkpoint inhibitors, Keytruda, which I'm sure most of you have read about, and talking about vaccines. So at the moment, there is no immunotherapy that's on the pharmaceutical benefit scheme for mesothelioma. Patients can have it, they've got to pay for it. It's costly treatment. And these are the drugs that are available, Keytruda or pembrolizumab, nivolumab or ipilimumab, and then dendritic cell vaccines. So just to recap about the T cell story. So, as I said before, the T cell is the soldier of the immune system. It's what has to go off and try and kill viruses or to kill, and hopefully in this case, cancer cells. And the dendritic cells, also known as antigen-presenting cells, are the cells that process those cancer cells or viruses and present these particular proteins to these T cells and basically, if you like, herd them into attacking that particular cancer cell or virus. So the dendritic cell is very, very important, but the T cell is also critical because without the T cell targeting the cancer cell, we're not going to be able to get rid of it. Now the issue is that cancer cells, where it says APC or tumour cell, in this case we're going to assume it's a tumour cell. What has to happen for the T cell, the immune system cell, to kill a cancer cell is it's got to lock onto it and it's got to spike it and kill it. The problem is that cancer cells have extra proteins that are holding the T cell at arm's length. And there are two notable ones. Through this mechanism, through PDL1, and another one, these proteins that bind to CTLA4. So what drugs like Keytruda do, they're actually antibodies that have been designed to attack these proteins. So the idea is to take the block away and so that the T cell can actually interact with the cancer cell and kill it. There have been a number of trials now looking at Keytruda and Opdivo and some of these other checkpoint inhibitors in patients with mesothelioma. Across the board, it would seem that somewhere between 20 to 30% of patients respond to that treatment. So what I mean by response is tumour shrinks, symptoms improve. I think what we're starting to realise is that because these drugs are trying to harness the immune system to deal with the cancer, the immune system has to be functioning. They have to have a healthy immune system. And unfortunately, one of the things that happens as the cancer of any type becomes more advanced is that the immune system's not working properly. So you can't get something working if it's already sick. So I think the point is that with immunotherapy, we need to use it in patients who are healthier, possibly earlier on in the disease before things take over. We know that in the patients where it works, it can be long-lasting. So I have patients who have melanoma or lung cancer where we were able to use it on a more readily basis, who have their cancer under control for 2, 3, 4, 5 years. So it can work very well once it does. The side effects are relatively few, and mostly because the immune system starts to attack other organs within the body. It's not chemotherapy, so it doesn't have chemotherapy side effects. And very lastly, I just wanted to present this because this is the study that Tatey alluded to, which is a dendritic cell vaccine study that was purely sponsored by ADSS, and we used that in combination with chemotherapy. And basically, we spoke about the dendritic cells being important, and so what we did in this study was to try and create a vaccine to try and stimulate the dendritic cells to target the mesothelioma, but to use it in combination with chemotherapy. Without going into too much detail, there is evidence that chemotherapy might actually improve the way that the immune system works by taking the brakes off and allowing the immune system to function better. Creating the vaccine is very involved. We have to put people on a machine. We've got to collect white cells out of their body. We have to then incubate them with certain growth factors to change them into dendritic cells. We have to take a biopsy. We've got to incubate those dendritic cells and the cancer together, and then we've got to inject the patient with them along the way. We had 17 patients on that trial, and I won't show you all the results. But what I would say is that we did the vaccine in different sequences with the chemotherapy. It was very well tolerated, and the conclusions from the study was that it was a safe technique. It was easy to administer, and we had patients who went on for 2 or 3 years with their mesothelioma, many of them already having chemotherapy and other treatments. It was expensive, and it cost about $10,000 per patient to have that treatment, which could only be done by sponsorship from ADSS. What's the future hold? Well, I think immunotherapy is on the horizon. We've got a lot to learn about how to use it and when to use it. In other types of disease, other types of cancers, it looks like combining it with chemotherapy up front may be a useful way to use it, and also combining it with radiotherapy. And these other things we spoke about, CAR-T and dendritic cell vaccines, are expensive, but we may have to put that in comparison to the cost of chemotherapy and other drugs like Keytruda. So I'll finish there and take any questions.
Thank you very much, Dr. Horwood. A quick question from me. You mentioned the T-cell therapy in the United States costs $500,000. Is that available in Australia? And if so, how much would it cost? I know medical treatment is very expensive in the States.
It is, yeah. I think there have been discussions that it may still be in the range of kind of $350,000 to $400,000 to do that. And the issue is that it's very dependent on, you need science, you need a lab that's designed to do that. You have people who are specialised in doing it. So it's quite involved. And, by no means I could explain to you what the process of how it's done, but it's expensive. But again, if it can be done as a one-off treatment, it's effective. If you compare to the cost of Keytruda and all the other things combined, it might soften the relative costs. But as far as the treatment for mesothelioma, we've still got a long way to go to say that that's effective.
Any other questions for Dr. Horwood? Trevor?
Thanks, Keith. One of our members has had the radical surgery. He's in the Northern Territory and we visited him, and it has prolonged his life.
Yep.
What would you ever recommend it?
Well, it's kind of one of those situations where I usually see people who've already been through the hands of the surgeons. Yes, I have sent patients to see surgeons about it if they've come along and it looks like they may be a candidate for it. But again, I think you have to be very select about that, and I think that the surgeons that do that operation in this country are very particular about who they do it on, because it's very involved and the recovery takes months and months.
Yes,
It's-
I
Can be very debilitating.
talking to Ken, it was almost. I'm not sure whether the cure was worse than the disease.
That's right. And again, it's often in the US where there's a bigger population, larger centres where they do that. They do that surgery in combination with chemo and radiotherapy, so what they call a trimodality treatment. So the patient really often has gone to hell and back by the time they've had all that done. And sure, there are patients who live for extended periods of time, but we don't know in retrospect, well, are those patients really good anyway? Are they going to live? Because we all have seen people who've lived for many years with mesothelioma. Is it the treatment or the disease that's allowed them to live so long?